Primary immunodeficiency disorders, or PIDs, are a group of genetic disorders that affect the cells and proteins of the immune system. Therefore, people with PIDs have an increased susceptibility to infection. They may also have autoimmune diseases in which the immune system attacks their cells or tissues. PID is thought to affect 1 in 1,200 Americans and can occur in individuals of any age. Many PIDs have a genetic origin and are passed on in families. If your doctor suspects you may have a PID, he or she will ask about your history of illnesses and whether any close relatives have an inherited immune disorder. Perform a physical exam. Order tests which can determine whether you have normal levels of infection-fighting proteins or immunoglobulin in your blood and measure levels of immune cells. Testing can also determine if your immune system is responding properly and producing proteins called antibodies. These antibodies identify and kill bacteria or viruses. Parents with children diagnosed with a PID should consider being tested during future pregnancies. Treatment for PID aims to reduce the frequency of infections, prevent complications, and prevent acute infections from becoming chronic and causing potential irreversible organ damage. Antibiotics may be used to treat and prevent infections, while immunoglobulin therapy is used to boost the immune system. Immunoglobulin therapy in most cases is necessary for the patient's lifetime. Here is the good news. Immunoglobulin therapy is administered 2 ways, through IV infusion or subcutaneous injection. Infusion duration and frequency varies by product and route of administration, so you may have options for treatment. Remember, patient preference in treatment is important. Discuss all options with your doctor. For more information on primary immunodeficiency disorders, visit www.cmeoutfitters.com/PID.